Norway's crown princess Mette-Marit is facing one of the most serious moments of her life, and the latest reports have left royal watchers across Europe deeply concerned. The future Queen of Norway has reportedly been placed on a waiting list for a lung transplant after a major deterioration in her health. Mette-Marit, now 52, has been living with pulmonary fibrosis for several years, a serious lung disease that causes scarring inside the lungs and makes breathing increasingly difficult. There is no cure for the condition, and according to recent medical updates, her situation has now become life-threatening. This is not just another royal health update. This is a deeply personal and frightening chapter for the Norwegian royal family, because the palace has made it clear that Mette-Marit now needs a transplant as soon as possible. She has also been forced to suspend her official royal duties while doctors focus on her treatment and the long road ahead. For a royal family that has already been dealing with intense public pressure, legal controversy, and emotional strain, this news adds another heavy burden. And for Mette-Marit herself, it marks a dramatic turn in a health battle that has quietly shaped her life for years. The timing is especially emotional because it comes just after reports that her daughter, Princess Ingrid Alexandra of Norway, is leaving her studies in Sydney to return home and be with her mother. Ingrid Alexandra is not just any royal daughter. She is second in line to the Norwegian throne, a young princess who represents the future of the monarchy. Her decision to come home underlines just how serious the situation has become inside the royal household. When a future queen's daughter leaves her studies abroad to be close to her mother, the message is clear. This is no ordinary setback. This is a family pulling together in the face of a medical crisis. According to the palace statement, further updates are not expected immediately after the transplant process begins. Once Mette-Marit is discharged from hospital, she will face a long period of rehabilitation and training. That means the public may not hear much for a while, even though interest in her condition will be extremely high. The palace appears to be preparing the public for a slow, private recovery rather than a stream of regular public bulletins. That is understandable, because a lung transplant is not a simple procedure. It is major surgery, followed by a difficult recovery process. Patients must rebuild strength, adjust to life after the transplant, and remain closely monitored by medical teams. For someone in Mette-Marit's position, the medical challenge is enormous, but so is the public pressure. A lung specialist from Oslo University Hospital, our home, explained to Norwegian broadcaster NRK that patients who are placed on a lung transplant waiting list are usually considered severely ill. He said that people on such a list are often in a condition where they may only have around a year left to live without the transplant. That does not mean anyone can predict Mette-Marit's exact future, but it does show the seriousness of the medical threshold she has now reached. Home also said that Mette-Marit's pulmonary fibrosis has worsened significantly over the past 6 months. According to his comments, recent images show much more scar tissue developing in the lungs over the past year. That detail is frightening, because pulmonary fibrosis becomes dangerous precisely because scar tissue makes the lungs stiff and limits the movement of oxygen into the blood. For anyone who has followed Mette-Marit's health journey, this is the development many feared. She was first diagnosed in 2018 with a rare form of pulmonary fibrosis. At the time, the Norwegian palace confirmed the diagnosis, and from that point onward, her public schedule began to change. She had to reduce her workload, take sick leave at different points, and carefully manage her royal duties. Some engagements went ahead, but others had to be scaled back or canceled depending on her health. The disease has followed her quietly in the background ever since. In public, Mette-Marit has often tried to continue as normally as possible. She has appeared at engagements, supported Crown Prince Haakon, and carried out royal work whenever her health allowed it. But recently, observers noticed signs that her condition was becoming harder to manage. She has been seen using oxygen during engagements, and earlier this week, she was seen arriving at Oslo University Hospital. Those images, combined with the palace's latest statement, have made the situation impossible to downplay. Back in December, Mette-Marit herself revealed that her illness had developed faster than she had hoped. That admission now feels even more significant. At the time, The palace confirmed that doctors had started preparing for a lung transplant evaluation. That was already a serious step. Now, with reports that she is on the waiting list, the concern has deepened further. Crown Prince Haakon has also spoken openly about his worry. Last month, he said Mette-Marit was seriously ill and that he believed her health had worsened recently. He described the previous months as a period with different phases, saying they simply had to handle it as best they could. When asked whether she would be placed on the transplant list, he said that decision belonged to the doctors. That answer revealed the reality of the situation. This is not a palace decision. This is not a matter of royal planning, scheduling, or image management. This is a medical question, and the doctors are the ones who decide when the time is right. And now, according to the latest reports, that time has arrived. The waiting list process itself is uncertain. Holm explained that it is not possible to say exactly when Mette-Marit will receive a transplant, because everything depends on when a suitable organ becomes available. That is the painful reality facing transplant patients everywhere. There may be protocols, medical evaluations, and prioritization systems, but there is also waiting. And that waiting can be emotionally exhausting for the patient and the family. Holm also emphasized that the hospital follows protocol exactly. That is important because whenever a royal or public figure receives medical attention, questions about fairness can arise. His comments appear intended to make clear that Mette-Marit is being treated within the same medical framework used for other patients. Still, the public interest will be intense. Mette-Marit is not only a patient. She is Norway's future queen. She is the wife of Crown Prince Haakon, the mother of Princess Ingrid Alexandra and Prince Sverre Magnus, and one of the most recognizable royal women in Scandinavia. Her health affects not only her family, but also the public role of the Norwegian monarchy. That is why this moment feels so significant for Norway. The country has watched Mette-Marit evolve from a controversial royal bride into a long-serving crown princess. When she married Crown Prince Haakon, her past attracted major public scrutiny. Over time, she worked to build a role within the monarchy, focusing on causes such as literature, youth, health, and social issues. Her presence became familiar, and her position as Norway's future queen became part of the royal landscape. Now, that future is facing a frightening medical test. But the health crisis is not the only challenge surrounding the Norwegian royal family right now. Mette-Marit has also been under renewed scrutiny over her past connection to Jeffrey Epstein. In a recent television interview, she addressed her former relationship with a convicted sex offender, saying she regretted the friendship and believed she had been manipulated. The interview was emotional and appeared to be an attempt to confront the controversy directly before it caused more damage. It was a difficult moment because Epstein's name remains toxic in any royal context. The British royal family knows that better than anyone after the long-running fallout involving Prince Andrew. So when another European royal has to address links to Epstein, the public reaction is always intense. Mette-Marit's interview was clearly meant to contain the damage, but it also placed her personal judgment back under public examination at a time when her health was already fragile. She has not been accused of criminal wrongdoing in relation to Epstein, but the association alone created serious headlines. Then there is the legal case involving her son, Marius Borghøiby. Marius, Mette-Marit's son from a previous relationship, was charged last year with rape and sexual assault. The allegations are extremely serious and include multiple accusations, including claims involving women who were allegedly asleep at the time. He has also been accused in cases involving bodily harm. These are allegations being dealt with by the legal system, and the court process has placed yet another cloud over the royal family. A verdict is reportedly expected on June 15th, adding even more tension to an already painful period. For Mette-Marit, the emotional weight must be overwhelming. She is dealing with a life-threatening illness, waiting for a lung transplant, stepping back from official duties, watching her daughter return from overseas, facing renewed public discussion about Epstein, and living through the legal fallout surrounding her son. Any one of those issues will be difficult on its own. Together, they create one of the most challenging periods any modern European royal has faced in recent memory. That is why the human side of this cannot be ignored. Royal families often appear polished from the outside. There are palaces, ceremonies, formal statements, national events, and official photographs. But underneath all of that, these are families dealing with illness, fear, uncertainty, scandal, and private pain in the public eye. Metamart's situation is a reminder that titles do not protect anyone from serious illness. Pulmonary fibrosis is brutal because it slowly steals breath. The lungs become scarred. Oxygen becomes harder to absorb. Everyday activities can become exhausting. For a person whose role involves public appearances, travel, speeches, and constant visibility, the disease can be especially limiting. Every engagement requires energy, and every public appearance carries the pressure of seeming composed, even when the body is struggling. That is why her decision to suspend royal duties is so important. This is not a temporary pause for rest. It is a necessary step as she prepares for one of the most serious medical procedures a person can face. The palace's message about rehabilitation and training after discharge also suggests that even if the transplant goes ahead successfully, recovery will take time. The public may need to prepare for a long absence from royal life. For Crown Prince Haakon, this is also a defining personal and public moment. He has to support his wife privately while continuing to carry the weight of his role publicly. He must help his family through a medical crisis while the monarchy continues to function. And he must do all of this while the Norwegian royal household is under scrutiny for reasons far beyond Metamart's health. The return of Princess Ingrid Alexandra may help emotionally, but it also signals the seriousness of the family situation. Ingrid Alexandra is preparing for her own future role in the monarchy, and coming home now places her close to the heart of the crisis. She is a daughter first, but she is also a future queen watching her mother face an uncertain medical future. That is a lot for any young royal to carry. As for the wider Norwegian public, the reaction will likely be a mix of sympathy, concern, and complicated debate. Many people will feel compassion for Metamart's health crisis. Others may still raise questions about the controversies surrounding the family. That is the difficult reality of modern monarchy. Personal suffering does not erase public scrutiny, and public scrutiny does not erase personal suffering. Both can exist at the same time. What happens next depends largely on the transplant timeline. A suitable organ must become available. Doctors must decide the right moment. Surgery must go well. Then comes the long recovery, rehabilitation, and rebuilding of strength. The palace has already warned that updates may be limited at first, which suggests the family wants privacy during the most difficult stage. That privacy may be hard to maintain completely, but it is clearly needed. For now, the clearest message is that Metamart is seriously ill and that the Norwegian royal family is entering a deeply uncertain period. Her future royal work is on hold. Her medical team is preparing for a transplant as soon as possible. Her daughter is returning home. Her husband has admitted he is worried. And the palace is asking the public to wait for further updates only after the procedure has taken place. It is a sobering moment for one of Europe's most visible royal households. The monarchy is built on continuity, tradition, and public duty, but life can interrupt even the most carefully managed institution. Metamart's illness has now become a national concern, and whatever people may think of the controversies surrounding the wider family, the health crisis itself is profoundly serious. The coming weeks and months could be crucial. If the transplant goes ahead, the focus will shift to recovery and whether Metamart can eventually return to public life. If the wait continues, concern will only grow. Either way, Norway's future queen is facing a battle that goes far beyond royal headlines. And for royal watchers, this is one of those moments where the drama of monarchy gives way to something much more human. A wife, a mother, a future queen, a patient waiting for a chance to breathe again. So now the question is simple. Should the Norwegian royal family be given full privacy during Metamart's transplant battle? Or does her public role mean the palace should continue providing regular updates? Drop your thoughts in the comments, because this is one of the most serious royal health stories Europe has seen in years.